I'm Dr. Sachin Patil, consultant brain and spine surgeon at Manipal Hospital Kharadi. And today we're going to talk about a very important topic, that is head injury. Now, when it comes to head injury in India, the most common cause is road traffic accident or fall while working or sometimes assault. But when it comes to head injury in children or toddlers, they can simply get it while learning to ride a bicycle. Now remember, all of us, when we learn to ride a bicycle, we did it on the ground. If at all we felt on the ground, so impact was less. But now today, with the modern urbanization, all the societies and colonies, everywhere there is a concrete. And we had one such a case where a 5-year-old child who was learning to ride a bicycle, he fell down and hit on the concrete. And remember, whenever there is a head injury, there are 4 red flag signs. And if you see any of these signs, you should immediately get the patient to the hospital. The first is loss of consciousness after head injury. Second is vomiting after head injury. Third is bleeding or water coming off ear, nose or mouth after head injury, or any fits. So if you see any of these signs, you should immediately get the patient to a multi-speciality hospital where you have all the facilities, the emergency facility, the CT scan, MRI, surgical facilities if needed, blood bank if needed, under one roof. So the parents of the child noticed that this child had a loss of consciousness and there was one episode of vomiting. They immediately got the patient to the Manipal Hospital. We did a scan. After the scan, I sat with the parents, told them that see, there is a major blood clot on the left side of the brain and it is putting pressure on the brain. So we have to perform a life-saving surgery, otherwise there is a risk of life. And without any hesitation, they said, okay, doctor, please go ahead with the surgery. So we performed the surgery, we made an opening on the brain and removed the clot. Next day, I had a doubt whether because of the clot, the child he had sustained any permanent brain injury or not, because the left side of the brain controls the right side of the hand and leg movement and also a speech center. But with the grace of God, the patient slowly started regaining the consciousness, and when we extubated the patient, we called his mother, and child immediately hugged his mother and he held her and he was saying mummy, mummy, mummy. So I could see that okay, he's able to speak and he's able to move his right hand and leg, and there is no permanent damage the child has suffered, and we have performed a successful surgery. So the message I want to give through this video is that the 4 red flag signs, that is loss of consciousness, vomiting, any bleeding from the ear, nose or mouth, or fits, immediately get the patient to the hospital. And the last thing is the safety precaution. It's very important to wear a helmet while riding a two-wheeler or even while simply learning to ride a bicycle. So helmet is essential. If at all if this child had a helmet, we could have avoided the head injury. So remember, helmet is must while riding a bicycle or a motorcycle. Thank you very much.